Hello, today we are going to discuss a few chest radiograph signs. So this is a chest radiograph showing homogeneous opacity involving the right upper lobe. We can see few linear lucences coursing through the opacity. So these are the air-filled patent bronchus. This is known as the air bronchogram sign. So we see this in either consolidation or non-obstructive atelectasis. In this case, it is consolidation because there are no features of volume loss like tracheal pulling, crowding of ribs, or crowding of the bronchovascular structures. So this is a case of consolidation with air bronchogram sign. We see the air bronchogram sign when a patent air-filled bronchus is surrounded by infiltrate-filled or fluid-filled alveoli. So, to get the air bronchogram sign, the bronchus should be patent. We will not see the air bronchogram sign if the bronchi are filled with mucus, as in case of cystic fibrosis, or if the bronchi is obstructed by an endobronchial tumor or foreign body, which will result in obstructive atelectasis with no air bronchogram sign. So this is the next case where we can see an irregular thick-walled cavity with a homogeneous soft tissue component edema, which is surrounded by a lucency, that is a peripheral halo of air. So this is known as the air crescent sign. It is classically seen in aspergilloma. However, we may also see this sign in hydatid cyst, in which the paracyst ruptures into the adjacent bronchi. But the difference is that in aspergilloma, the cavity will be thick-walled and irregular, whereas in hydatid cyst, the cavity wall will be smooth-walled and thin. So it is classically seen in aspergilloma. The next case shows a smooth-walled, apparently thin-walled cavity with air fluid level within, where we can see a few homogeneous membranes floating over the fluid level. It gives a typical appearance of floating lilies. So this is the floating lily sign, which is also known as the Camelot sign. It is seen in hydatid cyst. So in this case, the paracyst remains intact, but the ectocyst and the endocyst ruptures, and the membranes float over the fluid. So this is seen in a ruptured hydatid cyst. Rupture means the ectocyst and endocyst ruptures, however the paracyst remains intact. So this is a chest radiograph where we can see bilateral, central, homogeneous opacities. The opacities are shaped like the wings of a bat, or we can also say that they are shaped like the butterfly wings, but classically this is known as the bat wing sign. It is usually seen in cardiogenic pulmonary edema. In non-cardiogenic pulmonary edema, the opacities will be peripheral. So that is the difference between cardiogenic and non-cardiogenic pulmonary edema. We can also see a few ECG leads. The next chest radiograph shows homogeneous opacity involving the right upper lobe with features of volume loss like tracheal pulling. The trachea has been pulled to the right side. The horizontal fissure has also been pulled upwards and medially, and there is also crowding of the overlying ribs. And we can see that there is no air bronchogram sign here, so most probably it is collapse, and that too obstructive collapse, because we cannot see any air bronchogram here. And the most prominent feature is the S-shaped appearance of the pulled up horizontal fissure. So this is known as the golden S sign. It is classically seen in central obstructive lesion. We can say it is an obstructive lesion because there are no air bronchogram sign within, and it is central in location. That is why it is preventing the medial displacement of the medial segment of the horizontal fissure. So the most common cause of a central obstructive lesion producing this kind of appearance is an endobronchial tumor, which is most commonly squamous cell bronchogenic carcinoma. So we should also look for rib erosions because they may lead to lytic erosions of the ribs, and lymph nodes, that is hilar enlargement on the contralateral side. The next chest radiograph shows a crescent-shaped lucency of hair surrounding the aortic knuckle. So this is known as the Luftsiegel sign. Luftsiegel is a Greek word which means Luft means air and sickle means crescent. That is a crescent of hair surrounding the aortic knuckle. It is classically seen in left upper lobar collapse. In this case, what happens? The superior segment of the left lower lobe interposes between the collapsed left upper lobe and the aortic knuckle. So the aortic knuckle contour becomes apparent against the air-filled superior segment of the left lower lobe. This is another chest X-ray where we can see that the entire contour of the left heart appears flattened. So this is known as the flat waist sign. We cannot appreciate the contours of the aortic knuckle, pulmonary trunk, and the left heart border. Usually these three are known as the three moguls of the heart: the aortic knuckle, the first mogul, pulmonary artery, the second mogul, and the left heart border, the fourth mogul. The third mogul is the left atrial appendage. In this case, we can see that we cannot make out the outlines or contours of the respective structures forming the left heart border. It is seen in left lower lobar collapse. So these were the cases for today. Thank you.